Phillip Day here from Credence Publications and the Campaign for Truth in Medicine. I'm delighted to welcome Dr. Bill Kellner-Read, dental physician, for this week's weekly health tip. All of you shuddering out there, this is about teeth and your complete neglect of them. And Bill's, well, I like to call him an expert on these things. He's author of 2 books, Toxic Bite and Chill Out.
That's correct.
Interesting title. Is that all about getting people to relax, or...?
I wish it were. I wish that I had some magic...
or is this your annual holiday out to the Maldives?
That would be nice too.
Okay.
Or even into the fridge with a name like Chill Out. No, Chill Out really, when I first came into dentistry and I looked at what was happening to people, I got a lot of people who'd come to see me or wouldn't come, and this was always the frustration. They actually wouldn't come through the door. They'd miss an appointment. I'd say, what's wrong? Oh, I've been to the doctor. He's told me I'm stressed out. I need to go home, lie down in a darkened room, learn to live with it, and perhaps take Valium. Because in those days, of course, Valium wasn't addictive, as you'll remember back 30 years ago. And so I wasn't really happy with the answer. I didn't really think that that worked. So I looked at stress and what it really was, because I felt that if people know what stress is, then chances are they can do something about it. Just to have a label doesn't really help you.
A lot of viewers watching will say, you're a dentist, what has stress got to do with teeth? People come along, they want to get their teeth root filled, or they want to have some sort of cosmetic work done on their teeth. You've made a specialty of actually looking to see how teeth affect the whole body, and that if people have got rotten teeth in their head, that in some way translates to some serious issues around the body. Can you tell us a bit about that?
Yeah, that's correct. I mean, when I first looked at this 25 years ago, I suppose, I was looking specifically at headaches. Why was it that people got headaches? Why did they miss appointments, which is always frustrating for any dentist? Why, where were they? What was going on? And I looked at the area of headaches and realized that dentistry has a lot to play, or a big part to play, in how headaches develop and what to do with them. As you look at structure, which is what dentistry is all about, you realize that structure can affect not just the head, but the neck, and the rest of the body. So that you look at the bite as it affects the skull, as it affects the cervical spine, as it affects the rest of the system. If you can change the bite, you can change the way the cervical spine works, and you can help people with headaches, neck aches, back pain, and systemic conditions as well. So that it was really a progression from headaches to head and neck pain, to head, neck and back pain, clicking, locking jaw joints, and on we went from there. And as you look at a holistic approach to dentistry, then those are the things that naturally follow one from another.
I was interested to read an article on a guy called George Meinig, who was asserting, this is the horror story to end all horror stories, by the way. This is all about having teeth root filled, where you've now got dead teeth in the head, and now the immune system can't get in to service the teeth. And you've got miles of these passageways inside the teeth that play host to bacteria, which can break out throughout the body. And I noticed that you did mention this in Toxic Bite and looked at that in some detail. But this is a serious issue because, I mean, root canals and these types of procedures have become de rigueur, really, in the dental industry. And now we find that there's this sort of trouble.
Yeah, I think it's absolutely right. I think there are 2 ways to look at this. So first of all, with regard to the work that George Meinig has done, again, based a lot on the work of Weston Price. And it was Weston Price who did a lot of research into taking root canal or mummified teeth, taking them out, and for people who don't like things done on animals, remember that this is back in the 30s, he would take a tooth out of somebody with, let's say, liver disease, put it underneath the skin of a rabbit, and the rabbit would then get the disease that the person had got. So from that, he said, look, we have a serious problem going on here.
He was even able to grind up the teeth and administer them to the animal that he was testing on at that point, and they were still developing that disease, even though that it was ground up.
This is exactly
right.
So
what does that tell you?
Well, so, I mean, what that tells me, first, I think the important thing is to bring this up to date now and think about what we are doing to ourselves. We are taking a body that is already has a problem with the immune system, and then we're loading more stress onto the system. Remember, I said stress is a non-specific reaction of the body to any demand placed upon it. So what are you doing now? You're taking somebody's body who may well be nutritionally stressed, toxically stressed, and then saying, let's keep this tooth, come what may. If you have somebody who's perfectly healthy, this may be something you want to do. But once again, we were talking about this earlier, what you need to do is look at the body and the person and see where they are today before you go ahead and do anything else. And I think this is important. I think this is some of the work that Meinig was talking about. He wasn't damning out of sight root canals, what he was saying is, look, let's give this some serious thought before we just go ahead and do these on anybody. If you read in Toxic Bite, rather tongue-in-cheek but true, here in the UK, root canal season is around about October, November. You know, the first flu comes in, and all of a sudden, root canals that have been done for years, they blow up. People have abscesses coming all over the place. Why? Because that's when you're really challenging the immune system with a change in the season.
Plus all the stress with Christmas coming up.
Exactly right. Exactly.
Now, according to your website, which is authordentist.com, is that right?
That's
Author,
correct.
not dentist, authordentist.com. You're going to be in Australia in the coming months.
Yeah, that's right. I'm down in Australia in June and July.
Is that like a whole tour, or are you
No, it's just a mini tour. I'm just going down there. There's some things dentally I want to share with my own profession that I feel is part of this ongoing desire that I have to bring the general public and the dental profession together and say, look, there's a lot more, general public, that dentistry can do for you than what you're getting right now. And it's the same, say, to my own profession, come on guys, we can do more for our public, for our patients, than we've been doing in the past. How about we go and do that? How about we enter the healthcare profession at the level that I believe dentistry should be, which is addressing the whole system, not just saying, well, I've done your teeth, go home and live with it. Let's look at the system, let's look at whether root canals are the right thing for this patient, whether keeping these teeth is the right thing for this patient, whether implants is right, whether you take a child who's got crowded teeth and pull them out, put braces on the headgear and give them a neck problem for life and other problems within the system, or you say, how was this child as a baby? Did this child have digestive problems as a baby? Was it a colicky child? What was going on with this child as it grew up? Do I have the right to go in there and start to jigger around with the mouth before I know the whole picture? And what we need as a profession is to wake up to our responsibility for the whole body and not just the mouth and the teeth.
And in Toxic Bite, I was also fascinated to read that obviously you go very hard on nutrition. The whole idea is that if we exercise prevention, eat healthily, then we're not really going to have the problems that have beset us. People watching this are going to want to ask a dentist, come on, what do you think about mercury and fluoridation of the water and all of that? You've been quite outspoken about these issues.
Look, we've known that mercury is a neurotoxin forever. Anybody who's my age or older will remember the mercury thermometers. We used to break them. My dad was a GP. We'd get plenty of these. We break them. We play around with the mercury. We'd be told off because this was a neurotoxin. And yet what we're doing is we're putting it in the mouth.
Where it's perfectly safe until
Absolutely.
it falls out into the dentist's gloved hand.
And then it has to be disposed of underwater. That's correct. And now we have filters, of course, within the system to make sure that none of the mercury goes into, or none of the amalgam filling goes into the water supply.
And this whole fluoridation in the toothpaste thing, I'm against it. I've done a huge amount of research on fluoridation. The whole idea that we can take a toxin out of the aluminium and fertilizer industry and somehow kid people that this is going to stop dental cavities. I mean, plainly, if you don't want to get dental cavities, stop eating sugar. But it's a lot more than that, really. It's about changing attitudes and getting people back on. Is this? These are some of the subjects you're going to be talking about down in Australia.
Absolutely right. I think we've got to come back to basics. We've got to understand that fluoride, if there's a benefit, maybe possibly it's 15%. That's the research. Look at the York report. You pull it apart and see what it was really saying.
But that would be calcium fluoride. That would not be hexafluorosilicic acid or anything else like that.
Phillip, that's right. But if you look at the work of Dr. Sushila in India, and where they have fluoride in their water, they're trying to get this stuff out because of the effects of fluoride on the system. Once again, come back and look at the system. Let's stop just looking at the teeth. It's much easier to treat tooth decay than it is to treat osteogenic sarcoma, which is a bone cancer that happens in young men who've been exposed to high levels of fluoride, for example.
It's very refreshing. A dentist is looking at things holistically, nutritionally. Dr. Bill Kellner-Read is going to be down in Australia to do not only a couple of professional talks to his industry, but also some public meetings. You can find out those dates at www.authordentist.com, and highly recommend his book, Toxic Bite, and also Chill Out. Dr. Bill, thank you very much.
Thanks, Phillip.